Hi, I'm Sarah Hughes, and I did my disease report on tetanus. Tetanus is caused by the bacterium Clostridium tetani. So below you can see a picture, and on the right you can see its taxonomy. And Clostridium tetani is an anaerobic bacteria, so it has to grow in an area where there's not very much air. It's gram-positive, so you saw in the picture before, it stains purple when put under a gram stain. And it has two states. It has a vegetative state, in which it's not infectious, and you have, it's rod-shaped or bacillus-shaped, and it has a flagella, so it's motile. And in this state, it's about 2.5 micrometers long and 0.5 micrometers wide. In the spore state, it's that's when it becomes infectious, and it becomes what they call drumstick shaped, so it has one end that got a lot bigger. There's 11 different strains of Clostridium tetani, all of which cause tetanus, and it's found in soil, dust, and its most common reservoir is animal feces and the GI tracts of animals. It's not contagious, so I can't give tetanus to somebody just by touching them. The Clostridium tetani has to enter you through a puncture wound, usually. And so something interesting about Clostridium tetani is that it is closely related to the infectious agent of botulism, which is Clostridium botulinum. So they're actually in the same, they're really closely related. So how you get tetanus, Clostridium tetani spores enter the body, generally through a puncture wound, so like stepping on a nail or a splinter, but it could also be through like some kind of skin trauma or some kind of wound. And it has an incubation period of about 7 days, but that really ranges from 2 to 21. And the more serious your case is, the shorter incubation period you're going to have. So once inside your body, the spores begin to grow and reproduce, and once they've reproduced enough, they release those neurotoxins. There's two of them. The first one is tetanolysin, which nobody really knows what it does, but it doesn't seem to have a big effect. And then tetanospasmin, which travels through your lymphatic system, and once it reaches the neurons of your central nervous system, it binds to those. And it blocks the release of glycine and GABA at the motor endings, which causes the motor neurons to not be able to be stopped. So basically they're in a constant state of activity and you can't control it. So this causes involuntary motor neuron activation and muscle spasms throughout the body, which is one of the hallmarks and characteristics of tetanus. So the other signs and symptoms of tetanus, spasms or stiffness in the jaw muscles. So that is why tetanus is commonly known as lockjaw. And then you have stiffness in your neck muscles, difficulty swallowing as a result of that. You have stiffness in your abdominal muscles, and really painful body spasms that can last for several minutes. And these are triggered by super minor environmental factors, things that you would encounter in your daily life. So that can be anything from like a light breeze to a physical touch, like even a light physical touch, or even like a draft. And then secondary symptoms include increased blood pressure and heart rate, and fever and sweating. So there's 4 types of tetanus. The first and most common is generalized tetanus, and this occurs in 85 to 90% of all cases, and the most common symptom is lockjaw. It persists for 2 weeks, however, it takes about 2 to 4 months for you to be completely recovered from it. And so generalized tetanus is when you have those muscle spasms throughout your entire body. Localized tetanus is the second most common one, but that's only like 10% of cases. And this, the difference between localized tetanus and generalized tetanus is that localized only occurs in the muscle where you had the injury. And it has variable severity, so it can be super severe or it can be just really minor. The next is cephalic tetanus, which is only like 1% of cases, and that it follows a head injury or ear infection. And so this is just tetanus in your brain, so it causes a dysfunction of your cranial nerves, and it has a pretty poor prognosis. Lastly is neonatal tetanus, which primarily occurs in underdeveloped countries. I think there was only 1 case of neonatal tetanus in the United States last year. But this occurs when the umbilical cord is cut with like a contaminated object. And this causes a 70% mortality. So some of the symptoms of neonatal tetanus are a little bit different from regular tetanus. The infants don't so much experience the body spasms, but they have major irritability. They're unable to feed well, and they have really poor development for the first 2 weeks of their lives. And 70% of babies that get this end up dying. So some of the further complications of tetanus. So tetanus, once tetanospasmin has bonded to your nerve endings, it can't be removed. So really you just have to wait for new nerve endings to grow, which can take anywhere from 2 to 4 months, like I said before. However, so in that time, some of the secondary effects may be broken bones because you have really severe spasms. So like you saw in that picture before, the man who had his back arched really had a huge arch in his back, that could have caused a broken bone because he had a really severe spasm there. You can also get pulmonary embolism and death, primarily due to respiratory failure because of your severe spasms can stop your breathing, but it can also be caused by cardiac arrest or pneumonia. So, the way that tetanus is diagnosed, basically it's a physical examination and presence of the signs and symptoms of tetanus that we looked at before. And then the doctors will look at your medical and immunization history. So if you haven't been immunized or you haven't been vaccinated and you're presenting a couple of the signs, then you probably have tetanus and they're going to treat you for it. However, you can't get rid of the tetanus spasmin that's already bound to your nerves, so you have to treat just the symptoms. So first, you need to clean out the wound if it hasn't been cleaned properly to make sure that any more Clostridium tetani, if it's growing in there, it's taken out. Most patients need supportive care, which is just hospital stays, and a lot of them end up needing ventilators to help with their breathing. There are medications to ease the symptoms, which include antitoxins, antibiotics, and the vaccine, which are given to help your body get rid of those toxins that haven't bound to your neurons yet, so it can kind of decrease the severity of the disease. And then you also get sedatives in order to control the muscle spasms, so maybe you can avoid those broken bones. The good news is that prevention is super easy for tetanus. All you need to do is get the vaccine and stay up to date on your booster shot. So the vaccine for tetanus was introduced into the immunization schedule in the 1940s. And it's a tetanus toxoid containing vaccine, so it has an inactivated form of the tetanus toxoid so that your body can prepare to fight it off if the real toxoid if the real neurotoxin enters your body. And the United States recommends that you get a booster every 10 years. However, there is a little bit of talk about this because some countries don't even recommend a booster at all. And then there's some research that came out recently saying that you only need a booster every 30 years because that's how the vaccine will stay effective for up to 30 years. So they're actually talking about maybe changing the immunization schedule. So that's interesting. And there's 4 different types of vaccines. So these are all combination vaccines, different combinations of vaccines for diphtheria, tetanus, and pertussis. So children under the age of 7 will usually get the DT or the DTaP vaccines. And there's an immunization schedule. I think it's like 4 or 5 immunizations in like your first 2 years. And then after that, for people older than 7 years, they'll get the TD or the Tdap vaccine. So usually when we get a booster, we'll get the Tdap vaccine. And morbidity and mortality since the introduction of the vaccine into the vaccination schedule has decreased a tremendous amount. So we have had a 95% of decrease in tetanus cases in the U.S. and a 99% decrease of tetanus deaths in the U.S. So the U.S. has a really good number of, we have very few tetanus cases. This isn't the same for the whole world, but as the vaccine continues to do its work, the number of tetanus cases is decreasing everywhere. And these are my references, and thank you for watching.